Welcome to the 2019 fall semester debates. We are discussing physician-assisted dying today. Several states have legalized it in the United States thus far. The residency requirements vary, whether or not you have to be a long-term resident or not. Most states do not require long-term residency. They just require a simple medical bill with your address on it. Some states will even accept a fishing or hunting license with your name and new address on it. So the actual requirement to move and live in a state for a prolonged period does not necessarily affect people's ability to go to the states and have physician-assisted dying. It does require a terminal illness that is less than 6 months to live, and the debate teams will give you the various pros and cons of the issue as we progress.
Good evening, everyone. I just want to start with the debate by giving y'all a scenario and saying that if you're a physician and you've seen your patient from the past 4 years and now they're a stage 4 breast cancer patient and the cancer is now metastatic and is untreatable. You've seen this patient go from a very outgoing and rambunctious human being to a suffering and frail individual. If this patient comes to you and asks to end their suffering, what are you going to do? So the ethics and legality of physician-assisted suicide continue to be controversial, and several countries have legalized the practice while many countries are considering it. In the United States, 7 states, as well as Washington, D.C., have made physician-assisted dying legal, including California, Colorado, Hawaii, Maine, New Jersey, Oregon, Vermont, and Washington. Physician-assisted death, physician-assisted suicide, physician aid in dying, assisted suicide all mean the same thing. They refer to the prescription by physicians of a lethal dose of medication to patients upon their request and under certain conditions for the patients to take if they choose to hasten their death. In contrast, and used inaccurately in many debates regarding physician-assisted suicide, euthanasia entails the physician taking an active role in carrying out the patient's requests and usually involves intravenous delivery of a lethal substance. This is illegal in all states throughout the United States and is not an argument that we are discussing today. In medicine, autonomy refers to the right of the patient to retain control over his or her body. A healthcare professional can suggest or advise, but any actions that attempt to persuade or coerce the patient into making a choice are violations of this principle. In the end, the patient must be allowed to make his or her own decisions, whether or not the medical provider believes these choices are in their best interest, independently and according to his or her personal beliefs and values. So we can go to argue that autonomy is one of the health ethic codes that denying a person the right of physician-assisted dying goes against, as well as beneficence, which states that healthcare providers must do all they can to benefit the patient in each situation. All procedures and treatments recommended must be with the intention to do the most good for the patient. To ensure this principle, medical practitioners must develop and maintain a high level of skill and knowledge, make sure they are trained in the most current and best medical practices, and must consider their patient's individual circumstances. What is good for one patient may not always be good for another. And the last moral ethical code that denying the person the right for physician-assisted suicide is non-malfeasance, which means first, do no harm. This can also apply to helping a patient find the ultimate relief from pain through death. So if we're not allowing that, then we're basically causing more harm than we are for good. So while no clinical practice guideline exists, the most common request by patients with terminal illnesses is to die with some degree of dignity, and physician-assisted suicide allows a patient to make the autonomous decision to end their own life according to their desires and beliefs. In the onset of a terminal illness, the focus for the patient should be on doing everything possible to improve care at the end of their life by giving emotional support, great communication, and appropriate comfort to control pain. However, sometimes their pain is beyond medicine. It can go beyond therapy, it can go beyond medication, prescription. Sometimes it's suffering with depression, psychological stress, and the fear of loss of control. It is essential to respect the autonomy of a patient that is competent, terminally ill and wants to avoid excruciating pain and embrace a timely and dignified death. The role as a caregiver is to surround our patients with comfort and alleviate pain while respecting autonomy and a sense of control over the dying process can bring forth comfort to that patient. So for example, Brittany Maynard was a 29-year-old who had been diagnosed with brain cancer, and it was untreatable. There was nothing that anybody can do. So she lived in California at the time and chose to move to Oregon so she could do the Oregon Death with Dignity Act, ensuring her that she could have that medication to end her own life. At the time, California was not a state who allowed that, so she did have to move in, which is why the court case became a court case, because they wanted it in more states. So the Bouvier versus Superior Court is the right to die and an integral part of our right to control our own destinies so long as others' rights are not affected. Physicians who are approached with the request to assist in ending a patient's life have the right to decline on the basis of conscientious objection. Therefore, they are not affected according to this decision. Just as a physician can deny the right to abort a baby, they have the right to deny if they want to forego this treatment for a patient. The Oregon Death with Dignity Act allows terminally ill persons to seek assistance in committing suicide if they meet certain criteria, which is they have to be 18 years of age, a resident of Oregon, and they have to be capable, which means they're able to make and communicate healthcare decisions on their own. They must also be diagnosed with a terminal illness that will lead to death within 6 months. We are arguing today not to go past these restrictions. We are just arguing that we want this Death with Dignity Act in more states, allowing more people to have this right to die. Existing data of physician-assisted suicide does not indicate abuse of the practice, for the dominant motivation for requesting physician-assisted suicide include loss of autonomy and dignity, an inability to enjoy life and regular activities, and other forms of mental distress. A minority of patients interested in physician-assisted suicide and are offered this choice to die they won't actually assess this option. They like the idea of it, but then they back out, and which is their right to. So who are we to decide how another person wants to spend the end of their life? The right to die should be a matter of choice, not legislation. Thank you.
So, yes or no, do you agree that offering to help someone die goes against the code of healing?
Goes against the code of healing? No. Because I feel like healing is a broad term, and healing to you may be providing medicine to that person, but healing to me would be ending suffering to that patient.
But if you put yourself in a doctor position, would you be okay with the conscious thought of taking a life instead of saving one?
I personally would. That goes with what I was saying, where if you were a physician and you didn't like that right, then you don't have to. But if I am, and I saw a patient who I've seen for 4 years go through that traumatic experience and suffering, then I'm going to say, okay, I want to help you do what you want to do.
Are you familiar with the Hippocratic Oath?
Yes.
Okay, so to your knowledge, is there anything within it that states ending one's life is a goal for the doctors?
It's not a goal for the doctor, but again, we are not here to, it's not my choice as a physician to deny the right to you. If you want to commit suicide, then you're going to commit suicide. I'm just aiding you in the process of doing it in an easy and bearable way, whereas your family doesn't have to go through this process of watching you do it in a very non-calm and soothing way.
Well, with you saying that, isn't it valid to say that physician-assisted death goes against the Hippocratic Oath if doctors' primary role is to heal people?
I still don't think so.
Would you want your doctor to try their hardest to heal you, not kill you?
I would want their hardest to try to heal me, but then again, if I'm that patient who knows that I'm stage 4 and there's no treatment for me, and all I'm going to do is sit in that hospital bed dying and having my family watch me suffer, then no, I don't want him to try and do the best that they can. I want them to just end my pain.
Do you think there is corruption in the world?
I
Yes or
do.
no question.
Yes.
So doctors are humans, so do you agree that it might steer them to want a patient to take the option of physician-assisted death for corruption reasons, like money, anything else like that?
Absolutely. I believe the world is a corrupt place, and there's not much that we can do to fix that, but denying the right for one patient because of one physician or a minimum amount of physicians is wrong, then rather than all these physicians who are offering this in a very beneficial way and providing these people with what they want. It outweighs the good.
But so are you religious at all?
Very.
Okay, so if you are religious, don't you agree that physician-assisted death could be against your faith, especially if you're in a faith-based hospital? How do you think that would affect that?
So for me personally, I am very Christian and very high in my faith, but I believe in separation of church and state, and what I believe for me is different than what I should be able to say to you. So I am pro life for me and mine, but for you, I think that you should have the option to choose. It's not my religion for you.
But even if you're in a religious hospital setting, you wouldn't want them to honor that. You chose that. If you chose a hospital that had religion as, one of their main mission statements, you would want them to go against their mission statement?
No, because if I chose a religious hospital, then I would assume that they are denying me the right based on their Christian values. If I wanted to go seek physician-assisted suicide, I would go to a place where I know that they would agree and their morals and ethics are not based on Christianity.
So the Hippocratic Oath revision of 1964 says, above all, I must not play God. I will prevent disease when I can, and prevention is preferable to cure. So do you agree that throughout history, doctors' primary role is to help extend a life instead of take?
I do agree with that, but then again, it also goes from separation of church and state, where my religious beliefs aren't going to make policy.
A doctor takes the Hippocratic Oath and you want them to go against the oath that they take whenever they become a doctor.
I don't want them to go against the oath, but I mean,
That's what you're
if
just saying.
if a person is requesting that, then who am I to deny that? Who am I to deny that off of my Christianity values, that I should say, you know what, I believe in God and I think you're going to go to hell for suicide, so no.
I didn't ask about I asked about the oath. This is separating it.
Mm-hmm.
And you still believe that even though their primary role, even though they take the Hippocratic Oath is to take a life, you don't think that they should go against it?
I don't think it's going against it when a patient requests that to end their suffering. I think there's a difference between just killing them because it's malpractice and then killing them because they request it and that's what they want to do.
Okay. Yes or no question. Suicide is discouraged within our society.
Yes.
So, okay, with people are you okay with that people killing themselves if you say that suicide is discouraged?
I'm not okay with it, but I do have a quote for you. Physician-assisted dying is not suicide legally, morally, or ethically. Patients already are dying and therefore are not choosing death over life, but one form of death over another. They're not choosing to die, they're choosing the way they want to die. They're already dying, it's inevitable. Whichever way you're going to do it, they're going to die regardless. So they're not choosing to die over life, they're choosing the way they want to die.
Well, would you agree that the definition of suicide includes a human choosing to end their life?
Yes.
Okay, so is it a choice of the patient to opt for PAD?
Is it the choice of the patient?
Like, what I'm saying is, yes, they might request it, but if suicide is discouraged within our society, wouldn't you think that they wouldn't want that?
One individual patient?
Doesn't matter.
I don't think I'm catching your question.
I can ask you for one.
Okay.
Do you know if physician-assisted death is painless?
I do not know that, but I'm not a physician.
Well, then, if you don't know that if it's painless, why would you want? Like the person who is going through that, they wouldn't have the means to tell you if it's painless or not. So why would you encourage that? They could be going through all that pain, and you would never know. Would you want them to go through all that pain?
I am not saying that I would want them to go through that pain, but I'm giving them the option. I want this to go in place so they have the option to choose for themselves. Who am I to deny the right to die? Me individually, no, I would not choose that, but who am I to tell you that you cannot? No further questions.
Okay, so in 1995, Oregon became the first state in the U.S. to legalize physician-assisted death. It was very highly ethically questionable and controversial from the very beginning, and we saw that whenever Oregon only passed this act by a 51% vote. It barely made it into the courts. And looking still at Oregon statistics, since they did pioneer this for us, we saw that in 2017, 249 prescriptions for death were prescribed, yet only 168 people ended up dying directly from ingesting the legal medication. So that begs the question, what happened to 81 individuals? Because 81 is not a small number when you think of less than 250 people that were prescribed this medication. It's 35% nearly that did not die because of the medication. So one of two things happened to these people, and one of them was that they changed their mind before they took the medication. There's been various studies that have shown that individuals that suffer with suicidal thoughts often go back and forth in their mind with wanting to commit suicide and wanting to take their life. However, when the opportunity is placed in front of a suicidal individual and it's easy for them to do, they're going to take it more than likely. We saw something very similar happen in Great Britain whenever they brought in their carbon monoxide ovens. The female suicide rates of household-aged women skyrocketed because they could stick their head in an oven and kill themselves, and it was just right there. But whenever Great Britain switched back over to natural gas ovens, the suicide rates fell, almost lower than they were before. So that proves that whenever the opportunity is there, a suicidal individual will more than likely take the jump and commit suicide. So we're basically dangling death in the face because we don't know if that patient is mentally stable. We don't know if they're suicidal. We don't know their mental path. And by saying, yes, all this state is physician-assisted death is acceptable, that is dangling death in the face of those who could be mentally impaired, mentally suicidal. And we really don't need to make that mistake because we've already seen where Great Britain made that mistake. We need to learn from others' mistakes and not repeat them. History doesn't need to repeat itself when we've already learned from it. The more prominent reason why people didn't die from the prescription was because they died of natural causes before they were able to take the medication. Even with the act in place, people are still dying. Death has been happening since well before we were here, and it's going to go on to happen well after we leave. So people have been dying without the help of doctors for a long time now. And even with the act in place, it's being shown that people aren't needing our help to die. They're being written the prescription, yet they're dying before it. And whenever you take that, and it's happening naturally, the ethical questionability comes completely off the doctor. The doctor doesn't have to do any of that. They're not held accountable. They don't have to feel that mental drain in the back of their mind knowing that they gave up on a patient and opted to give them physician-assisted death instead of helping save their life. It's completely taken off the doctor when they die of natural causes, just as most of the 81 individuals, or 35%, did in 2017 in Oregon. Doctors take the Hippocratic Oath, and it's something that is a big deal to doctors. Like if they don't abide by this Hippocratic Oath, then they're malpractice and they don't get to practice anymore. And it says nothing in the Hippocratic Oath where you should aid someone in killing. All it talks about is healing. And the revision that my partner mentioned, it's a big deal. It says, I am not to play God. God deals with death. And it goes directly against the Hippocratic Oath whenever you become the angel of death and administer death as a treatment, per se. On the complete other side of that spectrum of morality, we can see where cases in the Netherlands, it's been shown where giving doctors this kind of power, the power to kill people, has created so much corruption within healthcare systems. And it's really hard because it puts stress and risk on already vulnerable populations such as the poor. For instance, say you have someone who is terminally ill and they come into your hospital and you as a doctor, or more specifically, this happened in the Netherlands, the doctor said, okay, they can't pay back their medical bills. We're going to treat them, and they're not gonna be able to pay it back. That puts us at risk. We're not gonna get paid and our hospital's gonna go under. Let's put them out. So when that's done, I mean, you cannot sway a patient to take any sort of treatment. And when that's done, that's already not in compliance with the law. And then it's so hard, not only is that a huge problem, it's so hard to build a case whenever your main testimony, the main parts that you need, that person's dead. The person that was taken advantage of, you can't get their testimony, and the doctors are oftentimes gonna go unpunished, and it's not gonna be done correctly because you don't have that person there because they were already dead. So most of the healthcare bills rack up within the last 2 years of a person's life. So this is scary because if insurance companies didn't have to pay out all that they do during the last 2 years of a person's life, they'd be making profits well into the billions if they didn't pay out what they do in the last 2 years. So that's almost giving them an incentive to sway physicians to give the physician-assisted death as a treatment so they don't have to pay out this cost, and it saves them money, and it just overall helps them out in the long run, which is illegal. I believe that physician-assisted death is unnecessary and uncalled for. Doctors were intended and they were put here and they trained to heal us, and they are supposed to help us aid in elongating our life. But instead, physician-assisted death is giving them the choice to end life. They are not to play God, and that is the law.
I have some leading questions and open-ended questions. I'll let you know if I want an explanation for some. Okay. Do you have compassion for patients who are suffering from chronic illnesses?
Yes,
Do you respect the patient's autonomy?
I do respect the patient's autonomy.
So, should the dying person be able to say that his or her pain and suffering is too much to bear and have the right to be free totally of that suffering?
No.
Do you think people should be forced to stay alive?
No.
Okay.
We've already seen where suicide is taking place in our country, and it's agreed upon that it is an issue, and they're not being forced to live their lives. They're committing suicide, ending their lives. So nobody's being forced to stay alive.
Okay. So, in lieu of that, how effective do you think the modern technology is to keep ill people from dying?
Our technology is improving, and it's highly effective.
Okay. So aren't physicians already prescribing medicines for palliative treatment, knowing that it will result in the death of a dying patient?
Death is inevitable. I'm gonna die, and you're gonna die, and so is everybody in this room. So whenever you do have palliative treatment, it is making them comfortable. It's allowing families to give their last goodbyes, allowing them to soak up their last couple moments of life in a comfortable manner. Yes, they're going to die, but anybody you treat is going to die.
Okay. So were you aware that physicians offers overestimation of survival rates for terminally ill patients with 6 months to live?
Was I aware? What was the first part?
Were you aware that physicians offers overestimations of the survival rates for that palliative treatment for terminal ill patients with 6 months to live?
I don't agree with that. Because there are numerous cases, and I'm sure you've heard of them too, where somebody was given 6 months to live, where they fell under the criteria of physician-assisted death, yet they outlived their expected life-ending sentence by much longer than that.
Would you rather convince a loved one who's dying from a chronic illness such as TB that is communicable to stay alive and be of risk to your other loved ones and to yourself?
I think you're going against what you argued, because you shouldn't be influenced. You said it was autonomy of the person. Well, if I'm influencing them, then it's no longer their autonomy, and it's my opinion, and that's not what it's supposed to be.
Right. If expanding palliative care can help lessen the means to legalize physician-assisted dying, how come not all adult Americans who are terminally ill have access to that care?
Why don't they have access to the care?
I'm asking.
I mean, I need to know that to answer the question.
Okay.
Medicare covers palliative care most all times in hospice. So most do have access. And those that don't have access to palliative care aren't going to have access to physician-assisted death either.
Okay, so do you think like those who are under like lower incomes have access to palliative treatment, and do you think they'll be able to make choices like to stay alive?
I think that those of the lower income are the ones that are in trouble if we continue to legalize physician-assisted death, because they can't pay back a lot and they don't have the means of money to care for themselves like others may, and they are the ones that doctors, in a sense, or hospitals or insurance companies are going to be like, yep, take them out. They can't pay us back.
All right. Isn't it a double standard when a physician gradually increased the appropriate medication for a dying patient, realizing it may cost them death?
Doctors do not overdose patients on purpose.
Okay. Do you rely on medication a lot when you're in pain, or you just let it occur until it's gone?
I personally do not go to the doctor very often at all.
Do you agree that the church and the state must be separate?
Yes, but do you agree that our Constitution literally says under God?
Since majority of the states ban physician-assisted dying, does this mean that the government have the right to make people suffer, especially the sick and the dying ones?
The sick and the dying are going to die eventually, so they're not making them suffer.
Okay, so isn't the opposition to physician-assisted dying just an attempt to impose religious beliefs on others?
No. You don't have to be religious to feel bad. I do not believe that in order to feel morally like you feel remorse for something, you don't have to be religious to feel that.
Okay. How about, do you agree in keeping convicted criminals with chronic illnesses from getting physician-assisted dying? Death?
Yes.
All right. And are you a hoarder? Do you keep some things that aren't of use anymore, or you discard them?
I'm actually OCD.
So if a treatment has become futile and the disease has been too much severe, will your perspective change towards physician-assisted dying?
No.
Okay. That's all the questions I have.
Well, in conclusion, like we discussed, there are many factors when one has to decide, the individual that is terminally ill has to decide what they want to do based on all of the already factors of falling into the certain criteria that need to be met. You have to be terminally ill, 6 months to live. So, to use that controversial assisted physician dying, we do not know when we will die unless we're told, like you're terminally ill, you have 6 months to live. We don't know if we're all of us, we might get hit by a car, we might die of breast cancer, we might die of an unexpected heart attack, or just dying of old age. Death, like the opposing side said, is inevitable. We're having the opportunity to pick when we die, and whom we die beside is our choice. I mean, there are so many laws in this wonderful country that says we can definitely the fairness of pick who we want to die with, and so that's where the fairness of American ethics falls under. As for being for PAD, we have to consider all 10 of the universal values of the American ethics. Okay, this is a decision that cannot be taken lightly. We referred back to Brittany Mayhart, who in 2014 was diagnosed with grade 2 astrocytoma form of brain cancer and had partial craniotomy and partial resection of her temporal lobe at the age of 29. Okay, we may all have a picture of death in our heads, of being old and frail, and that is not the case. You can be 2, you can be old, and that's the case in different cases. In her conscious mind, she decided to use PDA. She met all of the requirements, so that falls into us personally, we can do that. Human dignity of this is even if the disease kills us, it could still keep us living at the time because our body might still be young and want to fight the disease off. So we could live longer than 6 months, like you said. With that being said, there's already a number, there's already 9 states that are already, that are legalizing the PAD, and it's rising due to the demand. So I'm gonna go with this. Physician-assisted dying is not suicidal, like my partner stated. Suicide legally, morally, or ethically. Patients are already dying. That's the case that we are. They are already dying, have expiration dates. Therefore, they're not choosing death over life, but the form of death over the other. Thank you.
So in regards to PAD, or physician-assisted death, a doctor's primary role is to help patients, not kill patients. If society's perception of suicide is negative, physician-assisted death should not be allowed. Yes, I do understand that everyone has a choice, but the legalization of physician-assisted death can only lead to more conflicts and debates in the future. If only 9 jurisdictions have legalized physician-assisted death, doesn't that reflect society as a whole? Doctors' roles through the Hippocratic Oath is to help and heal people, not kill them. From an economic standpoint, physician-assisted death is only going to require more funding from the government, which will require more of your tax dollars as well. This means putting more hours into work and not taking as much home. Also, people can die naturally of natural illnesses and causes. Over time, the same result will occur, so physician-assisted death is unnecessary. Contradictory, many who are given 6 months to live can actually live much longer than the 6-month diagnosis period that a doctor gives them. Although what may be good for one patient may be good for the next, may not be good for the next, it can be agreed universally that death is what all doctors and patients try to avoid. So why is physician-assisted death being pushed? Physician-assisted death is unnecessary and uncalled for. Doctors were intended to help in patient healing, not aid in patient killing. Thank you.